Personalities and guests alone, and not those of Vic Canellis Media Group, its parent, affiliates, or stations. VCMG Live is not responsible for any content, information, or opinions expressed. User bears full responsibility for their reliance on such content, information, or opinions.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome back to another episode of You and Your Doctor, sponsored by All County Healthcare. Our number is 954-717-7027. We are a Medicare certified home healthcare agency servicing Palm Beach County, Broward, and Miami-Dade. I'm your host, Louise Gomez. Welcome to the show. And today we have Dr. Safia Ali. And Dr. Ali is located at 7171 North University Drive, Suite 200, Tamarack, Florida, 33321. Her number is 954-724-6454. Welcome to the show, Dr. Ali.
Yes, thank you for having me.
Well, we're excited to have you. Thank you for taking time out of your busy schedule and allowing us to pick your brain a little and get a better idea about what you do. And
sure, absolutely.
So, can you maybe just turn your volume up a little bit on your phone? Maybe that would help. So, Dr. Ali, if you could, that's probably better. Yes, thank you. Dr. Ali, if you can tell our listeners and our viewers a little bit more about your experience, your education, training, and background.
Sure, absolutely. I'm from South Florida, and I ended up doing my undergraduate studies in biochemistry and molecular biology at the University of Miami. I proceeded on to medical school there as well and graduated. And then I completed my residency in family medicine at Florida Hospital in Orlando. I did a transitional year with Mayo Clinic in Jacksonville. And since graduating, I had also gone on to practice emergency medicine and urgent care medicine for about the last 10 to 15 years with ambulatory care in there as well. Mm-hmm. It was during COVID pandemic that I ended up stepping into wound care. I practiced in Orlando for quite a bit of time and then relocated back to South Florida since my family is down here after getting married. And I ended up being the medical director for Cleveland Clinic's ambulatory care center during COVID. And during that time, everything was shutting down and we were open, and so was the hospital and the wound center, and they were very overwhelmed and had a high volume, so we would take their overflow, and that's where I ended up practicing wound care and stepping into it from the ER and ambulatory care background. And I loved it. I loved working with the wounds. I loved healing the patients. I loved dealing with their chronic wound needs. And it's just very gratifying to get them to a point where they're healed. So I decided to move further into studying wound care and became certified in it for wound care and hyperbaric medicine, and then joined with a very well-established wound care team and group called Freedom Wound Physicians. And we are now in collaborations with HCA Woodmont Hospital Wound Care and Hyperbaric Center, where I'm the medical director there, performing all wound care needs with hyperbaric medicine. So that's my background, and that's how I ended up where I'm at.
That's amazing, because it sounds like everything that you did along your journey really led you ultimately to what you said you're passionate about, which is the wound care. That's
Very
a,
passionate, yes. And
mhm.
let me just tell you the amount of involvement with the wounds and the needs for it, and coordinating patients' care, and it's just it's a passion, and it's great. I have an amazing team. I have two very strong wound care nurses and my office coordinator, plus our administrative director. We all collaborate so well together, and it's like a well-oiled machine. And patients love
Nice.
it. They love it because we're not just putting a band-aid on a wound. We're talking to the patient. We're talking to their primary care. We're coordinating care with their specialists. We're trying to figure out
Mm.
what's the underlying cause of the wound. Why is it not healing? And I meet with the patients on a weekly basis, and I debride their wounds, and we do very specialized dressings to help heal the wounds, skin grafting as well.
Wow.
And the hyperbarics is like an adjunct treatment to heal certain type of wounds, where we dive them. It's like an oxygen
Yeah.
tank. We dive them to 2 atmosphere below sea level pressure in the oxygen chambers, and they're getting pure oxygen that's compressed at 2 atmosphere pressure. That allows for better circulation, allows for growth of new arteries, allows for, if they're on antibiotics, to penetrate into the deep wound structure, and that helps to heal the wound faster.
So,
So since we started
mhm.
January 9th, that's how we've been practicing wound care in a very aggressive, very team-based approach.
Nice. Now, Dr. Ali, if you can share with us, I really would like to know what type of patient, I know you're saying wound, but like what type of patient would actually benefit from the hyperbaric chamber? I know my friend, her son was in a very, very significant car accident. It was and he actually did that
Oh,
treatment. Yeah, he had a brain injury. And I've
yeah.
seen miraculous
Oh,
changes in him. It's amazing.
yeah.
Yeah. So,
Yes, it regains a lot of tissue growth and function. So, to answer your question, we treat all patients of all different backgrounds, but what are the certain criterias, or what gets
yeah.
qualified for hyperbarics is basically your diabetic foot ulcers to help prevent amputation. We're like,
Mhm.
that's like a last resort, we're
Right.
their last stop before that, and we really try to save limbs. We're running a limb preservation program as well.
Right.
And you have radiation injuries, people who, unfortunately have cancers and have gone through
Yeah.
through chemo and radiation therapy. They get radiation wounds, and
Oh
so
wow.
those don't heal easily. So the oxygen chamber helps with that. We also treat chronic refractory osteomyelitis, which is another indication for chamber treatment. And that's basically when you have a bone infection that's been there for years.
Wow.
You already got treated one time with the
Mhm.
bone infection with 6 weeks of IV antibiotics, and it's still there, and you now need another course.
Mhm.
So the oxygen chamber really helps to heal the bone infection in that regard. Um, and
Nice.
crush injuries, like you were mentioning with,
Mhm.
unfortunately, with your friend's son,
Mhm.
with his motorcycle accident.
Mhm.
So there's quite a few different indications for it. We are very good about the case management and getting insurance authorizations and advocating for patients and doing letters of medical necessity if needed to get them approved for chamber treatment, because that could be a big rate limiting step, right? If you're not approved,
Yes.
how are they going to get in the chamber? So
Mhm.
we're definitely big patient advocates, our team. So everything is geared towards people's needs, and it's very patient centered. It's not just, oh, you came in for your wound, let me just look at your wound. We are looking at the whole person, and we
Nice.
treat the whole person.
Nice.
Yeah.
So, Dr. Ali, do patients need a referral for treatment at the wound care center? Is there a referral needed in order to see you?
Sometimes, like, because we're a specialty, like any other specialist, like a cardiologist or a
Sure.
pulmonologist or whatnot. We're very specialized. So sometimes, depending on insurances, if it's a HMO plan and the primary care doctor needs to put in the referral, then my team is really good. Rosie, who's our office coordinator, she's very good and strong about getting the referrals needed to get patients on her schedule. Because, you know, when a
Nice.
person has a wound, you don't want to delay their
Right.
treatment. So we're very good about coordinating with primary care doctors' offices to get the referrals needed.
Nice. So what is like a
Yeah.
typical day at the wound care center? What, like, if I was just going to take a glimpse in a day of your life, what would your day look like?
Oh, sure. Absolutely. And I invite you, come shadow me sometime. You'd
Oh
love
my
it.
God.
Yeah, no, definitely. Typically, we are appointment-based book
Right.
sessions with our patients. Each patient takes about 30 to 45 minutes because you have to,
Sure.
you know, undress the wounds, clean it, and then I come in and I do my surgical debridements. And the variety of wounds I have on my schedule, I can see up to 16 patients in a given day. And it could be a sacral pressure stage 4 ulcerated wound that goes down to the bone. It could be a diabetic foot ulcer that's, you know, getting some, maybe even gangrene. We've treated that before too.
Wow.
It could be a C-section wound, wound that's just not healing, you know.
Right.
We treat burn victims too. And and then vascular, that's a big one. Venous ulcers and arterial ulcers, predominantly venous ulcers. I would say that's a good majority of wounds that I'm treating because patients, we're all aging. And that was a topic I wanted to talk about with you is we're all aging.
Right.
We all get varicose veins at some point. Our leg circulation is something that not everybody thinks about, right?
Right.
Until you get a wound on your leg. And if that wound's not healing, there's probably an underlying circulatory reason, and most of the time it's a varicose vein or a venous issue. So we're very good about coordinating with local vascular specialists to get our patients on their schedule. So if they need a vein ablation or if they need some vein intervention, it gets done, and then the wounds heal quicker. There's not all that swelling, because you know that's what your legs do. They swell up when you stand for a long period of time, right?
Yes. Oh yeah.
And so, yeah. And so the venous ulcers is something I see quite a bit, especially in patients that are about 55 years or older.
Right.
And that's my first thought when I'm seeing those type of wounds, that, okay, let me talk to my patient, explain what we're about, how we're good about trying to heal the wound, but coordinating with the right specialist as well.
We're going to take a quick
and the other
commercial
thing that
break.
most
We're going to take a quick commercial break, Dr. Ali. We'll be right back, and we'll continue this conversation. All right, we'll be right back.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, Back to our show.
Welcome back. We have Dr. Ali, and she is at 7171 North University Drive, Suite 200, Tamarack, Florida, 33321. The number is 954-724-6454. And by the way, Dr. Ali is highly recommended by patients and all county healthcare. So we just want you to know we appreciate you, and you have been highly recommended in the community. Thanks for coming back.
Thank you.
Yes, your patients
Yeah.
are very happy with you, and they refer you a lot. So that's
That's awesome. Yeah, we started January 9th, and it's lovely to see how much we've grown from day one to now. And I just
nice.
hope we continue to grow, because we really do care about our patients. It's not just you have a wound for some of these patients have these wounds for a year or 2 years. So
Wow.
can you imagine the mental toll it takes?
No. Yeah.
Like to have that on your body for so long.
Yeah.
So we're really passionate about what we do, and we also pay attention to their mental health. And I'm always talking about that with my patients. That are you seeking counseling? I mean, we're going to do what we can with the wound, but I want to make sure you're okay. You're in a good
Yes.
space.
Yes, you're treating them as a
So,
whole. Yeah.
as a whole person,
As a-
definitely. Yeah.
Mhm.
I was going to touch on going back to the vascular
please.
topic we were talking about with the
Yes.
venous ulcers. One last thing I just wanted to mention was
Please.
compression stockings. That's just such a easy thing most people can start doing. Not too tight, but just
Right.
entry level that you can find on Amazon for most, especially as ladies who wear high heels.
Yes.
If we're on our feet all day, it's kind of like a little preventative measure you could do now to help with your venous circulation later in the later years. And that way, what the compression stockings do is it helps return blood flow to your heart.
Right.
So your legs are not swelling up, so the
Right.
veins are not getting engorged, and then over time getting collapsed and getting varicose.
Oh,
So that's just
yeah.
a little recommendation I wanted to throw out there.
Yeah, I mean, there's so many of us. Me, for example, I work from home. I'm sitting in front of a computer most of the day. I know that I have to make a conscious effort to like walk or to like even lay down with my legs elevated or do something, because after a while I just feel that it builds up, the just sitting and
Yeah.
not moving as much. So I know exactly
Yeah.
what you're talking about for sure.
Yeah.
So
and it's just a quick little fix you could do. So yeah, go
yeah.
ahead. Sorry.
Yeah, no, that's okay. I was going to ask you, do you see maybe down the road any type of new medical technology or any type of treatments that would be something that you'd be interested in providing as well? Because I know technology is changing so rapidly. Is there anything maybe that you're thinking about down the road or any
Well,
future goals?
Future goals is to expand and to have more chambers available for patients, because really the Hyperbaric is an amazing add-on for wound healing. It
Right.
really does speed up the healing process when it's indicated, and I'd just like to see that technology develop more and us be able to have more chambers and expand our practice more, so we're helping more patients and we're saving more limbs in that regard.
Mm-hmm.
That's our goal. That's my goal right now, because our limb preservation program is all about not getting amputated. And some
Wow.
of these ulcers on the legs and feet get so bad that, that's the last resort. So just developing our program in a stronger way using the hyperbaric technology, and then what we do in the wound center with our wound dressings and skin grafting, just making sure all of that comes together in a really good cohesive way. Those are our goals,
Mm-hmm. So, is it treatments that they would have to do weekly, or I guess every patient would be different, but is it a series of treatments that one has to do?
Yeah, that's a good question. So regardless of what type of wound it is,
Yeah.
every wound that I meet for the every person that I meet for the first time that has a wound and is new to our practice, We like to see them typically on a weekly basis so we can assess the wound, stage it, measure it, take pictures. And what we do is a surgical debridement on a weekly basis, which takes off that top superficial layer of dead tissue. So that allows for new tissue to come through underneath, and then we see how swollen it is depending on how much drainage there is, and then we apply specialized dressings that help heal the wound in between our physician visits. So typically every week I'm seeing a patient for their wound. Now, as they're healing, you need less visits, so then we space it out. Then maybe we're seeing them every 2 weeks or maybe every 3 weeks. And so towards the end, when they're growing new skin and new like epidermis and dermis,
Right.
then it gets really spaced out. And so we try, our goal is to try to heal most wounds within 16 weeks, which is about 4 months,
Nice.
Give or take, depending on what the person's doing. People go on vacation, things like that.
Sure.
And we also pay attention to their diet. If you're diabetic, you can't just eat anything you want. You have to be controlled for that wound to heal, or else it's not going to heal. We pay attention to that. We're monitoring sugar levels. Your protein, you need protein to build new tissues. So we're always talking about the diet and having the right amount of protein. Most people need at least 60 grams of protein to heal a wound a day. So there's a lot of discussion during those visits, which is why we see the patient every week. Even if I'm not debriding the wound that week, at least I'm assessing and seeing them and discussing their case with them every week.
Nice. Yes. So, Dr. Ali, we have 3 minutes left. So, if there's anything else you want to share with us, maybe is there a particular case that you may have in mind that you just, were so excited to see the results, or anything you'd like to share in the next 3 minutes? Please do. Please share.
Oh, yeah, absolutely. We had a patient, she was young, she just came in recently. Unfortunately, her relative's monster truck tire ran over her foot.
Oh my God.
Her foot was so macerated when I first saw it. It was like a very extensive foot and had tendon exposure. And through all of our really aggressive measures and then making sure she did what she needed to do, she healed within, last week was her last visit, and her start to finish process was about 10 weeks.
Wow.
And she did everything we asked, and we were very aggressive with her, with the compression wraps that we did, with the type of dressings we did. And we were able to heal. And she was amazed too, because she thought her foot was like a goner,
Right.
And that was just so rewarding. And she cried, we cried,
Oh, nice.
It was such a good moment. And I just thought, wow, we made a difference.
Of course. So it helps the bone. If it's a broken bone, it would help the bone heal faster as well?
Well, that's where we coordinate with a specialist like an orthopedist to make sure if the bone is not displaced and needs, some fixture from their point of view. But if it's a clean fracture break, and we get the okay from the orthopedist, we are able to heal the wound.
Beautiful. Nice. Well, thank you so much for taking time out of your schedule, Dr. Ali. The time has already come, and we've completed the interview, but I just want to thank you so much for being so passionate about your work and what you do, and it really shows. And it's wonderful to meet and interview doctors like you. So thank you so much.
Oh, thank you so much for having me. It was my pleasure, and I just wanted to get the word out there. That's all,
Absolutely. Thank you. Keep doing a great job. We'll talk soon. And
all right, take care.
Okay,
Bye.
take care. I was just going to say, I'm going to repeat your information one more time. University Hospital Wound Care Center, 7171 North University Drive, Suite 200, Tamarack, Florida, 33321. And the number is 954-724-6454. Have a great night, everybody, and we will see you next week. Take care.
Thank you for letting us share with you a longer and healthier lifestyle.